The production of this program is made possible thanks to the support of the following and viewers like you.
Renowned acupuncturist Dr. Linda Rapson was the 2021 co-winner of the Dr. Rogers Prize for Excellence in Complementary and Alternative Medicine. The $250,000 prize is the largest of its kind and available only to those who conduct their work in Canada. Dr. Rapson is an appropriate recipient. Throughout her career, she has battled the establishment. From the time she left medical school in the mid-1960s as one of only 13 women, she has broken down barriers and, as stated on the Dr. Rogers Prize website, swam uphill, developing unfailing courage and a thick skin to ensure that her creative and caring view would reach the conservative medical community. In 1974, after about a decade of practice as an MD, working with patients who were suffering from acute and chronic pain, Dr. Rapson entered the practice of acupuncture. Once again, she was a groundbreaker. She has advocated for patients access to acupuncture, gone to battle with regulators, worked with chiropractic, naturopathic, and acupuncture professional organizations and associations. Dr. Rapson has applied acupuncture treatment in hospice settings for people in palliative care beds, led groundbreaking HIV/AIDS treatments. She is currently introducing acupuncture as a treatment for people facing opioid and drug addiction challenges. I invited Dr. Linda Rapson to join me for a conversation that matters about acupuncture. Dr. Rapson, thank you for joining me.
You're welcome. Thank you for inviting me.
You are one of the co-winners of the most recent Dr. Rogers Prize. How significant is this prize in helping to consolidate the reputation of acupuncture and other complementary and alternative medicines? And we'll talk about that term a little bit later because maybe alternative is out of date. But how important is this prize that this recognition exists?
Well, I think it was brilliant of them to start this prize and brilliant of them to recognize that if it was a big amount of money, it gets a lot of attention. And that's the truth. But so it became obviously among people like myself a prize that we thought we would like to get, but never dreamt we would. I think it's helpful because the Dr. Rogers people are so aggressive about it. I mean, they have when the thing's announced, they're going directly to the newspapers and they're putting out material to make sure that people pay attention.
If we take a look at a young practitioner who is starting to move into the field of integrative medicine, it's easier for them, especially when there is this kind of recognition that comes with the prize. Is that one of the other benefits of having this prize, that it helps newer generations as they enter the discipline?
Well, I think that's true. On the other hand, I think that there's so much discouragement in medical school about learning about nutrition, let's say, that it falls on deaf ears, I think.
Why do you think that is? Because, you go back to the China study, the book where they pointed out that in medical school, they're not looking at the correlation between diet and cardiac health. And here we are 19 years after that book was published, and still you're saying the same thing?
Well, I think you have to agree that one thing COVID has taught us is that big pharma is running the world. And we found that out early because our Integrative Medicine Association, the CIMA, we as soon as it happened, we started having weekly Zoom meetings to develop a protocol for recommending how people could prevent getting it. And we got nowhere with this distribution of it. Nowhere. And we that was the first indication I had that it was not going to be easy to get anything that's not mainstream into the mainstream.
Well, you've been fighting this battle for a long time. You know, it starts with the beginning of your medical career. You know, the fact that you went through traditional medical route and became an MD.
I was very proud of being an MD for a few years before I started wondering about some of the, the way things were going with it. And I'll tell you, if I hadn't been naive, when as I tell the story, my mother-in-law convinced me I should go and learn acupuncture because she had such a terrible pain in her neck, and so she loaned me money to go because I said I can't, all the kids were little and I wasn't working, and she brought me $100 bill, and she wasn't a rich person at all, and so I went, and I was blown away. I had 3 days of training, and I was getting the most amazing results with when I treated patients. I couldn't believe it. I was like a kid in a candy store, really, literally. And I thought everybody would be thrilled to bits like I was, that we finally had something that could help people with pain. I mean, when a person with back pain walked into my office when I was a GP, I just wanted to, jump out the window because we knew nothing about it really. We weren't trained very well at all. And so when I could, put a needle in somebody and bang, their pain goes away, I thought that's wonderful. And I, as I say, I was naive, and I went ahead and got more, more training that was, the kind of thing that is just, you cobble it together because the Acupuncture Foundation of Canada was just starting. And I was learning from the doctors who had gone before me. Joe Wong hadn't come on the scene for about a year after that. And so when I decided I was going to leave my practice and go and work in the Acupuncture Foundation clinic the next year, the people I was working with thought that I'd lost my mind. They really did. They thought I was crazy. And I just couldn't see how you could turn away from it. It was such a welcome thing to know that you can do something to help people.
That must have been a challenging decision because you'd already been a groundbreaker getting into medical school. As I mentioned, you were one of only 13 women in that class of 120.
126. 10% was the quota. It was a quota.
So you really pushed against the odds there, and you made it through. And so to do all of that and then say, I think I'm going to turn my back on that for something that I think...
But I wasn't turning my back on it.
Okay.
I never turned my back on it. Because I was and in those days, I knew right away that, you got to do this all really well. Because the College of Physicians and Surgeons will come after you if you do something that's out of the norm. Mm-hmm. And the other thing about me was that I didn't have to. I wasn't the breadwinner in my family, really. My husband was, and so I could practice medicine the way it should be practiced. I didn't need to earn a certain amount of money. And that's one of the problems that we have with medicine now is, people decide how much an hour they want to bring in, and that's how many visits in and out they squeeze into an hour. And that gets in the way of critical thinking. It's really bad for everybody.
Well, it becomes only diagnosing symptoms and dealing directly with that rather than having a more holistic view of the patient that is expressing those symptoms. And so we were very careful to do everything properly the way you would in medicine. But the college still went after me, without a complaint. They went after me, and I was fortunate because they finally went after one of the other doctors. So she
because I couldn't have my own husband defending me. I had to have some other guy who was my lawyer. And when this other doctor went after her, same thing, no complaint, nothing. My husband, who was a very, very good lawyer, he issued some kind of a document demanding that all the people on the committee that were purported to think that she'd done something illegal would have to come before a judge and could have to swear it under oath. And both the cases were dropped.
But you stood a chance of having your medical credentials being revoked.
Yeah, sure.
It's a big risk.
Yeah, it is. But after that, I was safe because they knew who he was, you know, and I there was no reason to come after me. You know, acupuncture is the safest thing you can do. It's safer, I think, than doing nothing. Because when you do nothing, then a person may die from whatever it is you didn't treat. So I don't think there's any question about that.
So you start to advance into the world of acupuncture, especially around pain management. What were those initial treatments that gave you such promise and made you say, this is where I'm going to be focusing my energy?
Well, it was just a collection of a lot of successful treatments. You know, it became the norm. To now, over the years, I'm much better at it now than I was when I started, and I've learned a lot of different techniques along the way. Most recently, well, it's 10 years ago, but most recently, scalp acupuncture, which I just happen to have a book here. This is the book. This is the book that Jason Howe wrote, and we had him come and give a lecture, a weekend course for us back in 2012, so it was 10 years ago. And I was, then again, after all these years, I was like a kid in a candy store again, because this is so powerful. What you're doing is you're stimulating in the scalp over the part of the brain that needs to be helped in one way or another, calmed down or whatever, or stimulated, whatever. And I have the videos from the course that he gave, where we had a man who had a very serious brain injury, and he had a paralysis down one side, and he had been sent home from the rehab hospital he had a contracture of his knee, and it didn't matter because he couldn't walk. And Jason Howe, and I got it all on videotape, right in front of this course, he got this guy's arm and leg moving, and the woman who brought him was a physiotherapist who was doing home care with him, and she treated him. He was treated at the course in June of 2012, and she treated him at home until the beginning of August, because she had a baby, so she couldn't. And then in September, he went for a checkup at the hospital where they'd sent him home, the one they'd sent him home from. And now he was a perfect candidate for serial casting to straighten out his leg because he was walking. And 2 years later, when Jason Howe came back to Toronto, the man couldn't, and his wife couldn't come because they were going to a wedding or something. So the physio who had treated him, she went there and did a video. And he was sitting in a chair. He had a 4-point cane. He stood up. He got up himself. He walked about 30 feet, and he turned around and came back and sat down and smiled at the camera. The same guy who had a complete paralysis.
Wow.
Yeah, it's a wow. And when Jason, we saw the people that he treated at another course, there was a same kind of thing, a guy with a stroke, and he gets him going. Now that's not the end story. There was a woman who'd had an MRI and had a huge problem, and with sensitivity to sound and noise and stuff, and we saw the MRI. There was a where the lesion was, and he turned her right around. I mean, it was incredible what he could do.
When it comes to the use of acupuncture in the treatment of pain, are we talking primarily about chronic pain rather than acute pain?
No, we're talking acute pain is really fun to treat because you can get such a dramatic change. If a person has a pain that is where there's an overactivity of the sympathetic side of the nervous system, you put a needle here and the pain goes right in 5 minutes. I have slides where, for a case about that, which was a woman who was in Lyndhurst Hospital and the rehab where I'm attached to, and we asked for, do you have any patients, because we were doing a course, and they brought her to us, and she was heartbroken because she had had surgery in September of 2004. This was beginning of December. And she had horrible pain, just horrible pain. And the day before she came to us, she had gone to a multidisciplinary pain clinic in one of our teaching hospitals. And they had said they would get her back in January and they would do a block in her, nerve block in her neck. And she went back to the hospital in tears because she was in such agony. So she came, they brought her to the course, and she was able to walk with assistance. And when they took her coat off, her jacket off, as it went over her hand, she shuddered. You know, she had
from the pain.
Oh, from the pain. She had about only 20 degrees abduction out here. It was stuck, and it was horribly painful. And so I was treating her in front of a class of people taking the course. So this was my first needle, and the pain went from 9 down to 3 or 4 in 5 minutes. Just
okay. What's happening there?
Turned off the overactivity of the sympathetic, and then I did other points too, and we eventually got her so that we could get her arm out far enough so I could put a needle into her arm, her axilla, or armpit, to get at the nerves going down her arm. And this woman, we turned that pain right off, and she had been taking Percocet. That's how it was being treated at the hospital, and she was doing 12 of them a day. The next 2 days she took 2 a day. I mean, it was not a temporary improvement. My experience with that kind of pain, in that kind of early time, well, early, she'd had the pain for 3 months since the surgery. She had surgery on her neck because it was stenosis, and they didn't fuse it, and they had to operate on her a few months after we started treating her. And the surgeons don't like, if somebody's had this RSD, complex regional pain syndrome, they don't like operating on them because the chances are it can flare up again. Mm-hmm. And hers, it didn't come back at all. I had a 15-month follow-up on her. I contacted her, and she never got that pain back again.
What are the mechanics or electrical impulses and responses to acupuncture that allow for the relief of that kind of pain? And then what does that tell us about our understanding of pain?
Well, the sympathetic and parasympathetic are the two sides of the autonomic system. If the sympathetic is overactive, that's when you get this horrible pain. And it can be, life destroying, and doesn't go away if you don't get rid of it. If you can't get rid of it somehow.
Why doesn't it go away on its own? What has happened internally?
If acupuncture is used relatively early, or even that, that's 3 months. That's, if you're suffering, that's forever if you're the person with the pain. But then the chances of it working are very, very high. There's no controlled studies on it. The issue is that acupuncture is so safe We don't need a control. And each person becomes their own control. When you've had pain every day, every 24 hours a day for 3 months, and your pain goes away, you don't need somebody, you don't need a trial where somebody gets phony acupuncture. The randomized controlled trials were designed for drugs because drugs can kill you and can maim you and can harm you. And so you have to be sure that the benefit outweighs the risk. Well, with acupuncture, the benefit always outweighs the risk. It's hard to think of a circumstance where it would be, you have to modify how you treat, how aggressively you might treat something. But you're never sitting there saying, well, gee, what's the relative risk here?
Your clinic is devoted to helping those in pain, but you've also used acupuncture in helping people on the difficult journey with HIV/AIDS. How does acupuncture play a role there?
Well, when I was working, I was involved with starting our hospice, Casey House, and so I had a direct connection with a lot of people with HIV this was in the late 80s into the 90s. And so there were certain things that they had, like there was a neuropathy that they got from medication, and they responded really well to acupuncture. Whereas peripheral neuropathy itself, that you get with diabetes or some of these other, out of the blue you get it, the response with other people who didn't have HIV and weren't on those drugs, it was never as dramatic as what we could do with them. Otherwise, there were some very challenging cases that we tried it on and didn't get anywhere. We had a guy at Casey House who couldn't move his head, not a millimeter, but he'd get nauseated. And they tried everything, every drug they could think of. And I tried my acupuncture and it didn't help. It doesn't help everything. Mm-hmm. But when it comes to these sympathetic overactivity kinds of pains, I think that it helps almost all of them.
Dr. Stephen Sager, an oncologist, has embraced the use of acupuncture in the treatment of symptoms associated with radiation treatment.
He was very enthusiastic about acupuncture. We taught him, and he took it very seriously, and he and Raymond Wong did various studies.
How important is it to you now to have that kind of connection within the allopathic world?
Well, I don't know that. I'm not sure how important or fruitful it has been, because over the decades that I've been doing acupuncture, and it would be, I don't know how many years for Stephen, it would quite a few. There has been such the medical profession has really become, very reluctant to do anything that they can't make a profit on, or somebody can't make a profit on. So if it's not a gadget, like a TENS machine is a gadget, acupuncture machines are, acupuncture needles, you can sell them. But it's not the same thing as, it's easier to make money from medications.
And you feel that the medical community still is is driving more towards that versus opening its arms to a more holistic approach?
Yeah, I do. I really do. And I think that there's been an effort to create an attitude about going back to nutrition is a biggest one in a way, that's all garbage, that you don't pay attention to it. Anybody who's talking about nutrition is a quack, is what that's the extreme end of convincing people that it's not useful.
Don't we have the expression, you are what you eat?
We do, and if you're sensible, then you pay attention to that.
Paying attention to what you consume, and this has become the next part of your practice. That is helping your patients find the right dietary mix.
I decided that what I should do is treat people, get them started on nutritional supplements before I do the acupuncture. You see, I'm really good at not making money, right? So when you do that, like people with migraine, I get them all taking magnesium, and about a third or more don't need the acupuncture because, and we know, and even the neurologists know, there's evidence that it can help. Magnesium can help.
When you take a look at the landscape ahead of us in the field of integrative medicine, where do you think we are at, and what are the challenges that are ahead of us?
Well, I think we've become much more aware that there's sort of parallel universes going on here. That there's people who, like the functional medicine people, and the people who have studied acupuncture, who and the nutrition itself, just that we have a better understanding of what's going on in the human body. We're at a stage now where there's battle lines are drawn, kind of, I think, and I don't know.
I understand that, and I understand all of that argument, but I can't help but feel that more and more people are saying, okay, fine, you're my doctor, and I need you for specific health issues. But the greater and greater portion of the population are saying, I want to know more. I want to try other approaches because I'm in charge of my health.
Yeah, I know that. I know you're right about that, but where that's going to go, I don't know.
Thank you very much for your time today.